Hello and welcome to Winterwood. My name is Amanda. I'm the HR manager. And to begin your orientation on your first day, we'll start with HR. And we just want to provide you with some important information, particularly payroll and benefits, but some Winterwood history as well. So we will begin. Let's start out with introducing ourselves. The HR and training team are, again, I'm Amanda, the HR manager, and we have Kathy Jackson. She is the Director of Human Resources. And then we have Damaris Booth, our HR recruiter. You may have spoken with her. And then we have Sherry, our HR generalist. She provided your onboarding information. And on the training side, we've got our trainers. That would be Nick Cheney, Denise Summit, and Tom Rohr. And then we have our Director of Training, Stacy Sutton. The HR and training team are responsible for several areas, and that would include recruiting and onboarding, benefits and 401k, payroll, employee relations and performance management, FMLA and leave administration, and of course, employee training. Welcome you to the team. We're excited to have you. Before we move forward, just want to say anytime you have any questions at all regarding any of the items that we go over or just anything that happens in the future, feel free to give anyone in HR a call, a chat, or an email. We are always here to help. In today's presentation, we're going to talk about Winterwood's company history. We'll go over the vision and mission statement and take a look at the organizational structure. Then we'll get into a lot of detail about the benefits and payroll and Exponent HR, which is what you'll use to clock time and many other things. We'll highlight a few of the policies and procedures that you can find in your employee handbook. And then since your onboarding should already be complete and your I-9 documents should already be submitted to HR, you'll be ready to go. Winterwood is a family-owned real estate company, and we've been around for 43 years, and we're one of the largest in the region. We are in several states to include Kentucky, and in Kentucky we are actually all over, east to west, north to south. We've got several properties in Indiana, we've got a few in Illinois, a few in Virginia, and a property in North Carolina, and several now in Florida. In 1980, Carol and Buster Worsham purchased Winterwood. They were the only two employees and they had a total of 115 units. In 1981, they picked up their first additional management contract. That's with a property called Cardinal Meadow. That's in Harrodsburg, Kentucky, and we still manage that property today. In 1998, they decided to form what's called the Fez Group, and that was to focus on the property maintenance work. And a fun fact about that is how they came up with the name Fez. They used the initials of their children's name, Fred, Emily, and Zach. In 2000, they expanded outside of Kentucky for the first time when they picked up a management contract in Indiana. And then in 2008, we were continuing to expand, and a lot of the properties that we had purchased were getting older and needed to be rehabbed. So the Fez Group went into the construction direction. And today they are also not only doing rehabs, but they are building new constructions as well. In 2018, we welcomed Mike Hines as our CEO, and in 2020, Carol and Buster retired. And today we are managing over 340 properties. Winterwood, our vision is our people first, and it's more than just our mission statement, it's how we approach every challenge and serve every customer every day. Our mission is our residents first, our employees first, and our partners first. Of course, we're all here for our residents. We want to give them an affordable and quality home while maintaining high standards. And we couldn't do that without you, the employees. We want to give you ongoing training and development and career growth opportunities. And we're going to be working closely with our partners. That's going to be the communities, owners, vendors, and other business partners. To achieve our mission statement, we use the acronym SERVE, which is our values, and that is sense of urgency. So we want to do everything with the importance of the speed of business, but we still want to be efficient and consistent. We want to be encouraging to each other, maintaining an uplifting atmosphere in all of our offices and properties. We always want to be respectful to each other. We want to treat each individual in a courteous, fair, and professional manner. We want to recognize the value, the individual gifts and talents that each person provides, and through all that we get excellence, which is that highest level of service available. Here at the corporate office, we have our development, compliance, operations, accounting, and IT teams, as well as HR and training. Again, we've got the FES group, and they're out at the properties doing rehabs, working on those new construction properties, and they even do some historic preservation projects. Our development team is working closely with RD, Kentucky Housing, HUD, and many other entities to get the projects going for FES, which would be the rehabs and new constructions. And again, we are managing over 340 properties and growing.
At Winterwood, we offer a full package of benefits that include medical, dental, vision. You're going to receive vacation time, sick time, and paid holidays. We also offer retirement and matching, basic life insurance, disability income, health savings account, and we have supplemental policies through Colonial Life, including accident, critical care, and cancer supplemental policies. And we also offer an employee assistance program. All employees who work 30 hours or more are benefit eligible. Benefits are effective the first of the month following 30 days of employment. Your enrollment period begins 30 days prior to your benefit eligibility date. The benefits you choose during your new hire enrollment will become effective on the first of the following month. Your benefit enrollment will be completed within the Exponent HR system. Employees pay for their benefits the month prior, so depending upon when you complete your enrollment, you may be responsible for catch-up deductions. Amanda will reach out to you to make those arrangements. And unless you experience a life-changing qualifying event, you cannot make changes to your benefits until open enrollment the following year, which we normally hold in November. The life qualifying events are marriage, divorce, or legal separation, birth or adoption of a child, change in your child's dependent status, death of a spouse, child, or other qualifying dependent, or change in your employment status or your spouse's employment status. You will complete your benefit enrollment through Exponent HR on the benefit enrollment page. It will look like this once you log into your new hire enrollment period. The wizard will walk you through step by step what you need to do. You'll start with dependent changes. Click on that and it will walk you all the way through. Once your benefits are in effect, on your dashboard, you'll see the box to the right here. You will see what your benefits are and what you're being charged per month. So we offer health insurance, and this year we are with United Healthcare, and we have 3 different policies. We have your low option HSA, a traditional HSA, and a PPO plan. For those of you not familiar with an HSA versus a PPO, the PPO plan is where when you go to the doctor, you're going to pay a copay for the service, and that's mostly what you'll pay is just your copay. Unless they do blood work or anything else, and that's an additional charge that goes towards your deductible. The low option HSA and traditional HSA, those are medical plans that they're considered high deductible plans, and when you go to the doctor, the doctor visit goes towards your deductible. Now the doctor may charge you $200 for the visit. They will submit it to the insurance company, and there's a contracted rate that you are obligated to pay, which could be $125 and not the full $200. So the $125 or whatever that amount is will go towards your deductible. Now with a HSA, I do highly recommend that you open up and fund a health savings account, and we'll talk about that in a minute. We also offer dental through Delta Dental, and we have two plans, a PPO and a care plan. This PPO is a little different than a medical. It's just the higher coverage plan, more preferred provider plan is what it is, or dental care, which is pretty much a pay-as-you-go, pay per service. So if at all possible, I highly recommend the PPO on the dental. You're going to get better coverage and less out of pocket. And then we have vision insurance through VSP, and VSP is under the Delta Dental umbrella, and it's your typical vision coverage. It's going to cover a copay for your eye exam, and then you'll have different amounts for contacts or glasses. Okay, so I'm going to try to explain a little bit the difference between your HSA and your PPO. And so this box right here, this is based on employee only. And all the way to the right, you'll see the PPO. The cost per pay period for the PPO plan is $253.95 per paycheck. You cannot have a health savings account. Your deductible with the PPO plan is $1,500. So your annual cost just to be on the PPO plan, not counting any doctor visits or copays or nothing, for premiums only, you'll be paying over $6,000. And then you have to take into account your copays and other charges involved. Now, the low option HSA versus traditional HSA. The traditional will cost you $121 and some change per pay period. Then the $139 is a number that I've chosen to be equal to put into a health savings account. And a health savings account is it's a savings account that comes out of your check per pay period, and it is pre-tax. So that is your money that you set aside, and you can use it to pay for medical, dental, vision, and prescriptions. You can use it on yourself or any eligible dependent. So I chose $139 because if you are able to contribute that much, you will pretty much meet the federal limit for the year. And that will give you a little over $3,300 in that account to use towards your medical charges. And your deductible with this traditional is $3,200. So the annual premium cost for this plan, the traditional, is a little over $2,900. And let's say within the year, you actually meet your deductible of $3,200, you've paid your premium of just shy of $3,000, you would have spent over $6,000, okay? Now, if you choose the low option, HSA, Winterwood is adamant about keeping at least one healthcare plan affordable, and $10 is pretty affordable. But there's a high deductible. It is $5,000. Sounds scary, but it's not. Okay, so you're paying $10 a pay period for the low option HSA. With this plan, Winterwood will contribute $400 annually to a health savings account. So you're going to get $16.67 per paycheck into your health savings account. Same thing with the traditional. I highly recommend putting how much you can afford. If you can only afford an extra $25 or an extra $50 per paycheck, open up a savings account and put it in there. It's definitely worth it, and it rolls over every year. But for the sake of keeping this all equal, if you contribute $139, you will have $3,700 at the end of the year. That's what you've contributed, and that's the $400 from Winterwood. So the annual deductible is $5,000. Now, at the end of the year, you will only have paid $240 for premiums. That's it. Now, same thing with the traditional. Let's say you met your deductible. You met the $5,000 deductible. You would have only paid a little over $5,000 for the year. So if you look at the chart, you'll see how it makes sense for most people to choose that low option. But I am always available for questions. I know this is confusing. It shouldn't be, but it is. But feel free to reach out to me at any time. We also offer disability income, basic and voluntary life, and the health savings account. So with Prudential, we have short-term and long-term disability. Winterwood covers the cost for the long-term, and we allow you the option to choose whether you need short-term disability or not. Winterwood also has everyone a $10,000 life insurance policy, and in the enrollment you have the option to choose additional voluntary life insurance. So if you need more than the $10,000, you are more than welcome to choose any amount up to, I believe, $200,000 is the limit. Now we use McGregor for our health savings account. They are the holder of the money. It is a pre-tax savings plan set aside to pay for qualified medical expenses. And like I said earlier, medical, dental, vision, prescriptions, and you can use it for yourself or any qualifying dependent. We offer a 401k and we use Voya. So what that is all eligible employees, if you work 15 hours or more, after 90 days of employment, you're eligible to contribute to your 401k. It is an automatic enrollment of 3%. So if you don't want to contribute the full 3%, you want to do a little more, a little less, it is your responsibility to reach out to Voya. You will be receiving information in the mail from them, so you will have their contact information. Now, the company does match after 1 year of service. So what that is, the first 1%, Winterwood matches 1 for 1. After that, 2 through 5%, the next 2 through 5, Winterwood will match 0.5%. So what that means is, if you're fully funding of 6%, Winterwood will match 3.5%. And that starts at 1 year of service. After 6 months of service, you will receive 1 week of vacation time. And then after 1 year, you're going to get 2 weeks. All employees are eligible after 90 days of service for sick time. You will get 2 hours per pay period, and you can let that accrue up to 240 hours. Now the vacation time, we want you to use it. It doesn't roll over. But if something happens and you can't necessarily use all your 2 weeks, reach out to Amanda and she'll be able to roll over a few days up to a maximum of 1 week. She'll roll that over so it doesn't expire, but she will also put that in the floating holiday category, which means you have to use it at that point. But definitely use your vacation time. Now for the floating holiday, you get one of those every year after 90 days of employment. And that is a day that you can use for anything, but use it because you will lose it if you don't after a year. And then we offer 11 paid holidays every year. And you can see the holiday schedule in the employee benefit package that I send out later. We also offer an employee assistance program. The EAP is a confidential counseling assessment and referral service designed to help you and your family manage work and life struggles. This free comprehensive counseling service offers employees and their family members 6 visits per issue per year. It's a 24-hour hotline and it's answered by professionals and degreed counselors. This is private, it's confidential. We at Winterwood, we don't know who calls, we don't know who uses it, so feel free to use this. If you're struggling with anything, it's there for you, and with no worries that anybody here is going to know about it, so feel free. So within our benefit package, we also offer supplemental policies, and we use Colonial Life through that. So you are eligible to enroll or participate in accident, critical care, cancer, and supplemental life insurance. These policies are voluntary and administered through Colonial Life. The representative for Colonial Life is Jenny Westerville, and she will reach out to you within your enrollment period, and she likes to try to meet with everybody face to face, so I know if that's possible, she will do that, but be on the lookout for her calling or texting, and she can answer any questions about the policies that they have, but she's also well versed in our policies, so you can ask her questions and she can do her best to answer those. But Amanda and I are always here to answer any questions that you have about benefits. Exponent HR is the HR system of record for all employee information. You're going to learn about the daily time clock. You will see your payroll and holiday calendars. Once you're eligible, your vacation, sick, and holiday accruals will show up on your desktop. You'll also learn how to submit leave requests, view your paycheck online, your benefit enrollment, and update any personal information. So with that, I'm going to give it back to Amanda, and she will tell you more about Exponent.
Hi, it's Amanda again. We're going to talk about payroll for a few minutes before we get into Exponent HR. So Winterwood pays semi-monthly. That's going to be on the 15th and the last day of each month. If you're used to bi-weekly, it's going to be a little bit different. You're not going to see that standard 80 hours every other, say, Friday. It's going to be that bi-monthly. And so your hours are going to vary just depending on the pay period. And I'll show you how to look at your total hours at the end of each pay period so you'll know what you're going to get paid. If the pay date happens to fall on a holiday, you're going to be paid the business day prior to the holiday. And if the pay date falls on a weekend, you'll always be paid on the Friday before the weekend. Your first paycheck could possibly be a live check or a hard check. And if that's the case, I will mail that out to you to your home address that you list in Exponent. And I'll try to get that to you early. You'll get it before the pay date. I'll put a note on the check that lets you know what day it's available to be cashed or deposited, because if you deposit or cash before the actual pay date, it will kick it back on you, and it'll wait a couple of days before it does that, so it'll be a surprise. So I'll just make a note to make sure that you're aware of that. You can always reach out to me just to ask to see if you're going to be getting that first paycheck as a hard check or a deposit, and I can let you know. So we do a live time clock, and that's exactly as it sounds. Each day you're going to come in and you're going to clock in an Exponent, and at the end of the day you'll clock out. You don't have to worry about clocking in and out for lunch because we set that up automatically to occur in Exponent. So when you clock out at the end of the day, it will automatically add a 30-minute lunch. Please be sure to let us know if you've worked with your supervisor to take a 45-minute or an hour lunch. It's important to let us know so we can adjust that in Exponent. And for any maintenance technician that might be on call and get called out, say in the evening or on the weekend, if you don't take a lunch, it may deduct that from you anyway. So be sure to let me or your supervisor know so we can add that time back in for you. And as Sherry mentioned, benefit deductions are going to start the month prior to coverage. So for example, if you were eligible to begin your coverage on February 1st, your deductions would start coming out of your paycheck in January, the first paycheck in January. Now that could be difficult to get taken care of before the payroll is processed. It happens quite a bit, and that's okay. We can get you caught up. So when that happens, when I see your benefit enrollment come over in Exponent, what I'll do is take a look at it and see if we need to break that up for you, and then I'll reach out and let you know what to expect. So this is Exponent HR. So when you first log in, if you log in from a computer or a laptop, this is what you're going to see. It does look different on your phone, and you will be able to set up a shortcut on your phone. There's not actually an app, but the shortcut works the same way. Now on the phone or on your cell phone or mobile, it's going to look a little bit different than this. Same concept, just laid out differently. So before we get started on the dashboard piece, which is the shortcuts to your time clock, your paid leave, your pay calendar, and your benefits, I want to highlight where the orange arrow is pointing to My Info. So this is where you need to go anytime you need to change personal information. So you'll go there to change an address, a phone number, definitely if you need to update your taxes in the future, and then an update to your direct deposit. So we'll start out by looking at each of the shortcuts, and we'll start out with the pay calendar. The pay calendar gives you an idea of the pay dates and the holidays that we observe for the next year. So on Exponent, you can actually scroll through all the way through December of next year to see what day a holiday is going to be observed or what day you'll be paid. Holidays are in gray and pay dates are in green, and please ignore the yellow. So to get more information on pay dates, you can click at the top left of that box that says Pay Calendar with the little calendar next to it, and it'll take you to the screen that you see on the right where you have the column with the pay date and a column with the pay period dates. So before we look at that a little more closely, I will explain our payroll dates. So our pay period, since we are semi-monthly, there's 2 pay periods in the month. The first pay period will always run the 1st through the 15th of the month. Once that pay period ends, the payroll will be processed within a couple of days, and that payroll that ends on the 15th is always paid out at the end of the month, so that'll be the last day of the month. The new pay period will start the next day on the 16th, and it'll run through the end of the month, and then that pay period will complete, payroll will be processed, and it will pay you for the middle of the next month. Now that can be a little confusing, so if you want to get that detail broken out, you can see on the right where the pay period dates are broken out, and it gives you the exact pay date and the date and the date of the week. We can also get the holidays listed out if you'd rather see them in written form. And you can see on the right, and do apologize, this is the 2023 calendar. 2024 is not available just yet, but you do see that we observe 11 paid holidays, and those are New Year's Day, Martin Luther King Jr. Day, Good Friday, Memorial Day, Juneteenth, 4th of July, Labor Day. We do Thanksgiving and the day after Thanksgiving, so Thursday and Friday of that week. And then we do Christmas Eve and Christmas Day. So if you're interested in seeing, say, when Christmas Eve and Christmas Day will be observed, because maybe they fall on a weekend, this is the place to go and take a look. You can look on that calendar and it'll give you those holiday dates. Okay, let's take a look at a couple more of the dashboard shortcuts. We'll start on the left with the benefits summary. If you are benefit eligible, when your eligibility date begins, say for example February 1st, when you get into Exponent, you'll see this pop up, and any elections that you have made, it will show. Even if you have not elected a coverage, you will see it, it'll just show a 0. And you can always click on the View All Plans if you'd like to be refreshed on what you selected. To the right, you'll see the paid leave information. So as Sherry stated, at 90 days, you're going to be eligible for your sick pay and your floating holiday. So at 90 days, when the payroll is processed, it will add your first sick time, and that will continue to accumulate each pay period, and that is at 2 hours. You'll also see at 90 days that your floating holiday has been added. So that'll be available to use at 90 days. And then at 6 months, this is for your first year, you'll see your vacation time has been added. That'll be for 1 week. Now each year on your anniversary date, so this date each year, your vacation and your floating holiday time are going to reset. So you're going to want to make sure to use those. Now it's understandable that things can happen and you may not be able to use all your vacation. If that were to happen, just be sure to reach out to your supervisor and copy HR and let them know that you would like to request to roll over 1 week. So that's all we can roll over is that 1 week, but we will add that to your floating holiday balance if that occurs. So you'll want to be sure to use that first, because any floating holiday time is not eligible to be rolled over, whether it is the additional time or any rolled over time. To request leave, it is really simple. At the bottom left of the box, you'll just click Request Leave and follow the prompts. You can always check on any request that you have made on that second tab that says Request. It will list out anything you've requested and whether or not it's been approved yet. And then we have the time clock. So back out on the dashboard, when you log in each morning, you'll see your time clock. And all you have to do is go down to the bottom and click In, and that's going to clock you in. Same thing for the end of the day, just hop on and click out. You do not have to put in any time. It will automatically default to the current time, and that's when it will clock you in and out. Now, I do encourage you to check your actual time clock throughout the pay period, but definitely at the end of the pay period. And I'll show you how to do that in just a moment. Just a couple of notes before. If you happen to miss punching in or need a correction to a punch that you did make, be sure to reach out to your direct supervisor to let them know right away. Some supervisors will go ahead and make the correction. Some will wait till the end of the pay period. It's just important to let them know so you don't forget and that can get taken care of. Because any corrections that are not made at the time that payroll is processed will not be able to be included until the next payroll. Exponent locks down the payroll once it's processed, so it just won't be available to make any of those changes. So just be sure to review your time card throughout the pay period. Now, to get to your time card, what you'll do on the box that says time clock is click at the top left that does say time clock with a little clock next to it. Once you click there, it's going to take you to a new screen. And the screen looks like this. Now at the top, you see a lot going on. You see the month prior, the month of, and the month next to it, but you can just ignore that and just go down to the bottom where it's your actual time clocks in and out. So here it's going to break it down for you by each day, and you can see that the days that you've clocked in and out, your lunches have been added as well. Pay attention to the day total for each day to make sure that looks correct. And at the very bottom where it says total hours included in current pay period, just keep an eye on that as well to make sure that looks correct. Especially at the very end of the pay period on the last day when you clock out, you can come over and take a look and see that everything looks good, and you'll be able to also see what your total hours are going to be for your pay period. A few notes that are very important. On your first full paycheck, so the first paycheck that you receive that's a full pay period, take a look at your tax deductions and make sure that you're happy with those, because in 2020 the IRS made some changes and the tax deductions changed with those changes. So a lot of people saw a reduction in the amount of taxes that were coming out for federal. So just take a look, make sure you're okay with what's coming out. I wouldn't want a surprise to happen when it was time to file your taxes. If you need to make a change to the tax setup, that's when you would go to that My Info back on the dashboard and you can change it there. But you can always reach out to me or anyone in HR and we can help you walk through that as well. Direct deposit changes will require a 3 to 5 day business approval, and that's on Exponent's end. As soon as we see a request come over, which you would do in the My Info area as well, we will go ahead and approve that on our end, and that sends that to Exponent. Now Exponent, it takes them 3 to 5 days just to ensure that everything is correct. So they're going to send a test to your bank to ensure that it's going to your account, the numbers are correct. And so that does take some time. If you were to make this direct deposit change and it was still pending when payroll was processed, unfortunately Exponent can't look at what's pending, only what is approved. So it's going to default to your old direct deposit information until that approval occurs. So if you make a direct deposit change, just be sure to reach out to me. If you're not sure if it's going to happen during that current pay period, you can just reach out and I'll be able to let you know. Check stubs are always going to be available 3 days prior to the pay date, and it's back out on the dashboard. It's really easy to find, and you'll be able to access those there.
The Employee Handbook outlines Winterwood's company's policies and procedures. You will receive a copy of the handbook in today's email, so you will want to make sure that you look through all of them, make sure you're familiar with all of the policies, and pay close attention to a few of them. So the ones listed here are the IT usage policy, the key control policy. You're going to have access to a lot of keys on your property, and in some instances you could have access to the entire property. So please make sure that you are very familiar with what the policy is and what the procedure is should something happen. Now, Winterwood is a smoke-free workplace, so that we ask that you abide by that policy. And so each property is going to have a designated smoking area, and we just ask that you do pay attention to that. We have a substance abuse policy, fair housing policy and procedures. Now today you're going to be watching your fair housing training. That is training that all employees get when they first start, and you'll get it every year thereafter. Sexual harassment policy and ethical behavior policy. Winterwood's reputation for honesty and integrity is important to everyone involved in the success of the company. We take great pride in our reputation with regard to business ethics and intend to safeguard this. The ethical behavior expectations are outlined in the company handbook. This is one of the policies that you definitely want to pay attention to, read it, and know it. Now, if you have any questions about ethics, you can reach out to Amanda or myself or anyone on the HR team. But this phone number right here, if you see something that's unethical or you see something of concern, please call that number. That goes directly to the HR director, and she will investigate this situation and take care of it. The Dollar Club is a voluntary payroll donation used to assist individuals, families, or even community members who are in need. The enrollment forms were in your onboarding packet, so you've already had the opportunity to fill that out. Now, any employee can nominate someone. They can nominate a fellow employee, another resident, or even a community member who has fallen on hard times. The Dollarwood Committee has used this money to help many individuals in different times. We've used it to help with funeral arrangements. We've helped pay all of the rent sometimes, or portions of a rent if they've gotten behind, medical bills, school bills. There's guidelines on what the committee uses this money for. So if you have someone that is in need, reach out to the Dollar Club and we will take a look and see what we can do to help. So I hope this wasn't too painful for you, but if you have any questions, you can ask your supervisor right there. If it's something more in depth, please call Amanda or call myself. We're here for you. We're here to help. We want to help you. So welcome aboard. So the last thing that we have is your onboarding or your I-9. So if you will give your 2 forms of ID to your supervisor, they will get those copies to me and I will get your onboarding completed. So on behalf of the HR team and all of Winterwood, welcome aboard.